Hi, this is Emily Bodner. This is a presentation of my final paper for PC 700. Today we're going to talk about the effects of consistent exercise on mental health. It is known that mental illness affects many people throughout the world. Depression and anxiety are two of the most commonly diagnosed mental illnesses. While algorithms for pharmacologic and psychotherapeutic interventions are known and widely utilized, exercise as an intervention for improving mental health is still being researched. Exercise is correlated with improved symptoms, but no standard guidelines for exercise treatment programs exist. The goal in this PowerPoint is to identify some variables to create a generalized exercise protocol for people to prescribe as treatment. It's important to study the effects of depression and anxiety because they can be debilitating. The effects can cause poor workplace performance, dysfunctional social and family interactions, substance abuse, low self-esteem, poor body image, and interfere with activities of daily living. In addition, when stress triggers an onset of depression or anxiety, people with these illnesses often have poor coping skills that results in longer recovery periods. Poor coping may lead to longer time ruminating about an event and overall poor health. Traditionally, treatments for depression and anxiety were pharmacologic and psychotherapy. However, many people still do not adhere to these treatments. Why, I ask? Was it financial restraints, perhaps medications, or therapy was too expensive? Was it motivation? People didn't like the treatment they were getting, or maybe they felt like they needed more. This is where exercise comes in. Exercise has been shown to have high adherence rates, it's low cost, and prescribed exercise has been shown to reduce symptoms of depression and emotional disorders. Regular exercisers are less likely to be diagnosed with mental illness. It can help people rebound from emotional stressors and facilitate recovery. And exercises have more confidence in their coping skills. In addition, exercise can improve self-confidence, body image, mental strength, and overall health. It can become a preventative measure in reducing coping deficits. So the question now is, what variables should be included in these exercise treatment protocols? The first thing we're going to look at is intensity level, aerobic versus anaerobic. We know that both of these types of exercises release endorphins, which makes you feel good. Aerobic exercise is considered more cardiovascular. It strengthens the heart, it increases endurance. Anaerobic exercise is more strength specific and involves resistance training. Most studies have included aerobic exercise as an independent variable and haven't looked at how anaerobic affects the outcomes. The question is, does it matter? Well, one study showed that only aerobic exercise had effect. Another study showed the addition of anaerobic exercise had a slightly larger effect. Based on the research that I studied, my ultimate protocol is going to recommend aerobic exercise. But in the future, I believe that people should consider the access of different exercise that participants have available to them and the types of exercise a person prefers. I wonder if the access and the types, these preferences, might result in even more significant effects. So the next question is how long and how often? All studies agree that more consistent exercise is more effective than a single episode. Consistent exercise creates a routine and stable environment. The positive effects of exercise are a result of adaptations that occur over time, which suggests that a longer exercise protocol might result in more beneficial effects. One study reviewed different research with participants exercising 2 to 5 times a week. They concluded that exercise 3 to 4 times a week for a minimum of 9 weeks had the greatest effect in the reduction of depression and anxiety symptoms. The next question is supervised or unsupervised. Supervised exercise is when a trained professional is teaching a predetermined workout versus unsupervised, where a participant can choose their own physical activity and intensity level. Bernstein and McNally found that more improvements were seen with self-selected exercise. However, based on the research I did, I'm still going to recommend supervised exercise for reasons below. Participants are more likely to adhere to supervised exercise. Supervision may help alleviate fears that some people might have regarding starting a new program, a new treatment. And then it can be considered that trainers can modify variables as the program progresses, really adapting each program to each individual. And perhaps in the future, we could consider a mix of supervision and self-guidance exercise. So in conclusion, a recommended exercise protocol of supervised exercise involving moderate aerobic intensity 3 to 4 days a week for 10 to 12 weeks in length is likely to improve mental health symptoms and coping mechanisms. Because exercise has been correlated with less depressive and anxiety symptoms.